Na tukiangazia masuala yanayofungamana na jitihada za kupambana na COVID-19, tuende moja kwa moja tumsikie katibu mkuu wa chama cha wauguzi nchini Panyako akiongea kwa sasa.
Made yesterday and of course issued a press statement stating that the strike notice is still on and is said to begin on 18th of this month, as was stated in that strike notice. On the view, because reasons which are well known to everybody in this country. Number one, that in our strike notice we had raised the issue of risk allowance, which is not related to COVID-19. A risk allowance where the nurses have been getting 3,800 and others have been getting below 3,800, while one cutter has been getting 20,000. We want the harmonization of that risk allowance, which has not happened up to now, nor have we received a response from the government. Number two, we stating that those health workers, including nurses, who have been employed on dubious contract, be confirmed into permanent and pensionable terms and conditions of service, and the government should proceed and actually eliminate the issue of discrimination against certain health workers. For example, nurses who have degrees are not being employed, as well as those with a higher diploma. So we want this kind of discrimination to be stopped by the government and give a privilege to every Kenyan to enjoy the privilege in this country. You cannot train our health workers at degree level and then you refuse to employ them. There's no need then for that program to be approved by the government. We also wanted to be involved in COVID-19 package, as had been directed by the president, and one cutter making decisions on behalf of all of us. We have some cutters. My colleague was saying yesterday that the risk allowance cannot be measured in line of how much time you spend with workers. I think that is a short-sighted way of looking at things. If they feel that risk allowance cannot be looked at from the point of how many hours one spent with the patient, because that translates to hours of exposure. Some people have got very limited exposure, and they are the ones getting the highest amount of money.